Welcome to another practice question video. At the end of the video, sign up for free daily practice questions and free bonus nursing printables. Now let's begin. Starting with question 1. A child is admitted to the hospital with an uncontrolled seizure disorder. The admitting physician writes orders for actions to be taken in the event of a seizure. Which of the following actions would not be included? Notify the physician. Restrain the patient's limbs. Position the patient on his/her side with the head flexed forward. Administer rectal diazepam. The correct answer is restrain the patient's limbs. During a witnessed seizure, nursing actions should focus on securing the patient's safety and curtailing the seizure. Restraining the limbs is not indicated because strong muscle contractions could cause injury. Use and pad side rails with the bed in lowest position, or place the bed up against the wall and pad floor if rails are not available or appropriate. A patient who has received chemotherapy for cancer treatment is given an injection of epoetin. Which of the following should reflect the findings in a complete blood count, CBC, drawn several days later? An increase in neutrophil count. An increase in hematocrit. An increase in platelet count. An increase in serum iron. The correct answer is an increase in hematocrit. Epoetin is a form of erythropoietin, which stimulates the production of red blood cells, causing an increase in hematocrit. Epoetin is given to patients who are anemic, often as a result of chemotherapy treatment. Erythropoietin stimulates red blood cell production in situ. It is a hormone produced in the kidney and augments the differentiation of erythroid progenitors in the bone marrow. A nurse is caring for a patient with a platelet count of 20,000/microliter. Which of the following is an important intervention? Observe for evidence of spontaneous bleeding. Limit visitors to family only. Give aspirin in case of headaches. Impose immune precautions. The correct answer is observe for evidence of spontaneous bleeding. Platelet counts under 30,000/microliter may cause spontaneous petechiae and bruising, particularly in the extremities. When the count falls below 15,000, spontaneous bleeding into the brain and internal organs may occur. A nurse is caring for patients in the oncology unit. Which of the following is the most important nursing action when caring for a neutropenic patient? Change the disposable mask immediately after use. Change gloves immediately after use. Minimize patient contact. Minimize conversation with the patient. The correct answer is change gloves immediately after use. The neutropenic patient is at risk of infection. Changing gloves immediately after use protects patients from contamination with organisms picked up on hospital surfaces. This contamination can have serious consequences for an immunocompromised patient. Wear gloves when providing direct care. Perform hand hygiene after properly disposing gloves. A nurse is counseling patients at a health clinic on the importance of immunizations. Which of the following information is the most accurate regarding immunizations? All infectious diseases can be prevented with proper immunization. Immunizations provide natural immunity from disease. Immunizations are risk-free and should be universally administered. Immunization provides acquired immunity from some specific diseases. The correct answer is immunization provides acquired immunity from some specific diseases. Immunization is available for the prevention of some, but not all, specific diseases. This type of immunity is acquired by causing antibodies to form in response to a specific pathogen. Live vaccines are more effective than killed vaccines because they retain more antigens of the microbes. A patient is brought to the emergency department after a bee sting. The family reports a history of severe allergic reaction, and the patient appears to have some oral swelling. Which of the following is the most urgent nursing action? Consult a physician. Maintain a patent airway. Administer epinephrine subcutaneously. Administer diphenhydramine, Benadryl, orally. The correct answer is Maintain a patent airway. The patient may be experiencing an anaphylactic reaction. Airway management is paramount. Thoroughly examine the patient for airway patency or any indications of an impending loss of airway. Perioral edema, stridor, and angioedema are very high risk, and obtaining a definitive airway is imperative. A patient at a mental health clinic is taking Haldol, haloperidol, for treatment of schizophrenia. She calls the clinic to report abnormal movements of her face and tongue. The nurse concludes that the patient is experiencing which of the following symptoms? Comorbid depression, psychotic hallucinations, negative symptoms of schizophrenia, tardive dyskinesia. The correct answer is tardive dyskinesia. Abnormal facial movements and tongue protrusion in a patient taking haloperidol is most likely due to tardive dyskinesia, an adverse reaction to the antipsychotic. Tardive dyskinesia is a syndrome that includes a group of iatrogenic movement disorders caused by the blockade of dopamine receptors. A patient with newly diagnosed diabetes mellitus is learning to recognize the symptoms of hypoglycemia. Which of the following symptoms is indicative of hypoglycemia? Polydipsia, confusion, blurred vision, polyphagia. The correct answer is confusion. Hypoglycemia in diabetes mellitus causes confusion, indicating the need for carbohydrates. Neuroglycopenic signs and symptoms are signs and symptoms that result from direct central nervous system deprivation of glucose. A child is admitted to the hospital with a diagnosis of Wilms tumor, stage 2. Which of the following statements most accurately describes this stage? The tumor is less than 3 centimeters in size and requires no chemotherapy. The tumor did not extend beyond the kidney and was completely resected. The tumor extended beyond the kidney but was completely resected. The tumor has spread into the abdominal cavity and cannot be resected. The correct answer is the tumor extended beyond the kidney but was completely resected. Stage 2, the tumor extends beyond the kidney but is completely resected. Stage 2 would be a tumor that has grown outside the kidney to some degree, such as into surrounding fatty tissue. Usually, the tumor would be completely removable by surgery, and regional lymph nodes are negative. Which of the following conditions most commonly causes acute glomerulonephritis? A congenital condition leading to renal dysfunction. Prior infection with group A streptococcus within the past 10 to 14 days. Viral infection of the glomeruli. Nephrotic syndrome. The correct answer is prior infection with group A streptococcus within the past 10 to 14 days. Acute glomerulonephritis is most commonly caused by the immune response to a prior upper respiratory infection with group A streptococcus. PSGN most commonly presents in children 1 to 2 weeks after a streptococcal throat infection, or within 6 weeks following a streptococcal skin infection. Well, that's it with this video. See you next week for another set of questions. Leave a comment saying how many you got correct.